Andrew Kramer, Urology Associates, Cape Cod, and we're going to maintain that fact that we do at least 50% revisions. This gentleman is a third-time revision whom the original surgeon ran into some difficulties, I would say, getting the tips all the way up. So what we're going to have to do, overcome the challenge that was done infrapubically. So the cylinders we're going to have to get out. It's going to be tricky. The reservoir was really malpositioned, maybe because of the infrapubic placement, but we're going to have to get that out. Now that was really pushing on the cylinders. It was in a dropped low position. To get a revision surgery going, get the cylinders out, what you do is you deliver the pump like we did here and pump it all the way up. When you pump it up, you're going to show your cylinders because they are now going to fill up with fluid. Even if you don't like the way they're placed, you can find them easily. And once they're pumped all the way up, you cut right down on it. Easy to cut down on a very inflated cylinder because it's showing itself to you by being sort of filled and expanded, and to cut down on it is easier than when you try to cut down on a deflated cylinder. It is deep, it's hard to find, it's far from you, and you can get lost, get into the urethra, and just miss the cylinder. And then you pump it all the way up, and it's right there. So cylinders are out. We have a lot of work to do on the cylinders, especially getting them all the way to the tip of the penis. Before, they were extremely low, and that's the biggest reason we revise these things, that and sort of pump placement. So the pump was an issue too. So we're going to then use that goalpost test, make sure we have a cylinder holding the place in both sides, because that really shows you that left is left, right is right. Once you do that, by the way, in this case, it was not easy getting the old reservoir out. It was sort of buried and behind one cylinder for some reason, and it was placed infrapubically, and we are going to get it out scrotally. So my partner and I here, having done hundreds of these or more together, we have to put our heads together, as you see here, and dive down in a very tight space to get that reservoir out. And it's not going to be easy. And again, the danger of a cylinder issue is small, but the danger of a reservoir issue is you're in next to the bladder, into the iliac vessels, and we do get it out, thankfully. And now, with the reservoir out, we have our cylinders to turn our attention to, and that's what we're going to do. So dilating stops way short. So, and patients ask me, Doc, you're going to need to use the scissors. That's what they mean is this step. I have to get higher. So I need it mid-glans or into the head of the penis, not sort of mid-shaft. And the cylinder stopped before. There's capsule around that, so I'm going to have to go beyond the capsule, cut through it, and then dilate. That is the move that really is the thing that keeps people from doing revisions, or sort of keeps an implant from being perfect if you revise it, is difficulty in the skill set required to scissor through pseudocapsule and get a cylinder beyond it. So if you can do that, you can revise any implant, make the tips longer. You can take anyone that has an implant, make their penis longer. And when you revise them, people will come to you if you can scissor through capsule to get higher cylinders, and that's what we do here. So cylinders are now all the way up to the mid-glans, and demonstrating that they go way down. He's a bigger gentleman, which means the pelvis is low down, and the cylinders are going to go way up and way down. But we got the reservoir out. We got the cylinders out. We broke through the pseudocapsule. We got our tips all the way up. We did the triple splice. We got the pump low. Now we're done. We're going to pump it all the way up. And tips are good now, all the way up. The penis is much longer than before with tips that are all the way up. And at this point, we are ready just to close. I got to put that pump low and bury all that tubing, but that's another sort of trick or skill set. We sort of tunnel the pump, then we hold them down the tubing and close multiple layers. This is the finished product after we close the skin. So, Andrew Kramer, Urology Associates, Cape Cod, thanks so much.